Hello, how are you doing? My name is Charles Cuprill. I am the immediate past president of the International Academy of Oral Medicine and Toxicology, and I'm honored to have been invited by Monica and Katarina Griffiths to speak here at the Conference of Mitochondrial Medicine, MITO 2024, on the topic of our safe mercury amalgam removal technique program, also known as SMART. So we're going to go over a couple of the points and the history and everything regarding, the use of mercury amalgam in dentistry, and now how our processes and protocols can be utilized to protect our patients, our team, ourselves, and the environment at large. We'll also talk about some government processes and protocols that are coming into play that are very, very good news. And well, I hope that we can cover pretty much a lot of the bases that you'd be looking into this process. Let's start with a little bit about me. Again, my name is Charles Cuprill. I'm originally from Ponce, Puerto Rico. I live in Orlando, Florida. I graduated from the University of Puerto Rico School of Dental Medicine. I'm a biological dentist in private practice in Orlando, Florida. I've been in private practice for 21 years and 10 as a biological dentist. As I mentioned prior, I'm the immediate past president of the International Academy of Oral Medicine and Toxicology. From now on, we'll refer to it as the IAOMT, just to make it a little simpler. And I am currently an executive council and board member of the IAOMT. I am the chair of the IAOMT's environmental committee. And as part of my process for getting my fellowship in the IAOMT, I updated the SMART literature review as part of my scientific review. That's how I was able to get my fellowship in the academy. I've been a SMART certified dentist since 2016. And I did an integrated biological dental medicine course through the American College of Integrative Dentistry and Medicine in New Jersey. I'm currently completing a master's degree in neural therapy from the University of Barcelona and the Institute of Terapia Neural. And it's a great adjunct to my studies and formation as a biological dentist. I recommend it. So we're going to go over a quick, brief history of dental mercury amalgam to kind of, get up to speed of how this came to be used in dentistry. The history of mercury fillings. Well, mercury containing silver paste came from China in the 17th century. They dissolved copper, tin, and silver shavings into mercury. In 1816, Auguste Tavu created the first amalgam by the first amalgam filling by combining elemental mercury with shavings from silver coins. In 1833, the Krakows, two French brothers, immigrated from Great Britain to New York and brought dental amalgam to the United States. Given that I do practice in the US, I will be speaking about some of the governmental agencies and the regulations that we have in our country. I'm not abreast with the same agencies in Poland, but we go over those numbers because that's how we utilize that for setting up SMART protocols. So the first amalgam war. The first amalgam war was started in 1833 when the Krakow brothers introduced mercury fillings. Back in the day, you had barber dentists and dentist physicians. So you had dental schools were starting to flourish. You were starting to have some medical schools that were graduating dental physicians, but most of the dentistry was being done by the famous barber dentists. Basically, you went to the barber and they would give you a haircut, a shave, and they would also, extract teeth and do dental surgery along with fillings. Mad Hatter's disease was prevalent during this period of history, given the uncontrolled use of mercury in these fillings. The American Society of Dental Surgeons was the first organized dental association and established the first dental school in the United States, the Baltimore College of Dental Surgery. It was founded to standardize treatment, give licensed dentists credibility, and prohibit the use of amalgam fillings. The ASDS required a pledge to not use amalgam and began to lose dentists as they would rip up the pledge because they would look at the barber dentist and they would see the line out the door. And, they were looking at it as a business scenario. They were getting less business. So then, because they were losing business by pledging not to use amalgam, which was a required pledge of the American Society of Dental Surgeons, they would start ripping up their pledge just so that they could start getting patients through the door. It's business. But this just shows you the American Society of Dentists considered the use of dental amalgams to be malpractice. So they thought it was wrong to use mercury. But then again, we went on, started losing members because of the pledge, and eventually the barber dentists who chose to use amalgam, they formed the American Dental Association in 1859. So basically, the American Dental Association is formed from the remnants of the American Society of Dental Surgeons when pretty much all the members ripped up their pledge because they had to use amalgam, because if not, they had to survive the business. So there's the second amalgam war, in which Alfred Stock, PhD and German chemist and pharmacologist, defined micromercurialism in 1926 and recognized that the mercury-silver fillings were a dangerous source of mercury exposure. In 1931, the German chemist Borinsky documented the daily excretion of mercury in feces and urine after placement of dental milk mercury fillings on himself. They'll put down mercury-silver fillings here. We'll like to call them mercury fillings because in chemical nomenclature, you name a material according to what it has the most of. Given the fact that dental mercury fillings are 55% elemental mercury, about 29% silver, we're going to call it what it is, which is a mercury filling. The controversy lasted 13 years until the discussion was interrupted by the start of World War II in 1939. The third amalgam war comes around in the 1980s when Dr. Hal Huggins reintroduced his concerns about mercury toxicity. Mats Hansen, a Swedish neurobiologist, in 1982 again explained mercury poisoning from dental amalgam. In 1985, actually, it was 1984, but in 1984, the IAOMT was formed with the goal of producing the science to convince dentists to eliminate mercury. We just celebrated our 40th anniversary in Washington, D.C. at the IAOMT's annual conference, in where I passed the torch of president on to Dr. Yuko Torigo. So we have our first Asian and female president. So she's going to continue the good work. We expect great things from her. But yeah, it's been 40 years, celebrated 40 years. What is a mercury amalgam filling? So it's 50 to 55. They say 54, but I've seen 55% elemental mercury, less than 35% silver. What we tend to see mostly is about 29% silver. It's got about 9% tin, 6% copper. And in this case, when you start noticing that there's high copper and low copper amalgam restorations, the higher the copper, the higher the release of mercury by about 50%. And then there's some trace of zinc, and there can be other filler metals in there. So basically, it is a mixture of dissimilar metals that gets put together, and that actually creates an amalgam filling. It hardens the filling. Not only do we have the mercury issues here, we also have the galvanism issues that comes from taking dissimilar metals and putting them together in the presence of saliva, basically creating batteries. And if you go to the IAOMT's page, there's actually videos by Dr. Steve Coral, who is no longer with us, and it's called the potato clock, where he actually utilizes filling materials to create a current that actually lights up one of these children's clock toys that is actually done by putting everything through a potato to utilize the current there. Fundamental facts about mercury. So it's a heavy metal. The atomic number is 80. Atomic weight is 200.59. At room temperature, it is a liquid. It has a gas. It's colorless, odorless, tasteless, and it vaporizes very, very easily. Again, I have Fahrenheit on here because we are in the States and we use Fahrenheit. So I apologize for not translating into Celsius. The vaporization doubles every 50 degrees Fahrenheit. It is very reactive, given that it oxidizes very, very easily. So, it is a very volatile material. It is the most toxic element on this planet that is not radioactive. It off-gases a lot, even off of fillings. It's been known that the half-life is about 50 years. So you're going to off-gas about 50 to 60 years mercury off your teeth every time you chew, you brush, anything touches the tooth. And it's about, 3 inches from our brain, which is the tissue that it likes the most to go in there and cause problems. There's a very, very good resource book here by Dr. Tom McGuire. It's called The Poison in Your Teeth, where he actually talks about the hazards of dental silver materials. He talks about in his book, he says that mercury is the most poisonous, non-radioactive, naturally occurring substance on our planet, as I mentioned earlier. There is no safe or harmless level of mercury. Just one atom of mercury is harmful to the body. Amalgam fillings continuously release poisonous mercury vapor, and any form of stimulation that either heats the amalgam filling or rubs on the amalgam will create a release of mercury vapor off of that filling. Now, heat will increase the release of that vapor. So when we chew food, when we eat hot food, we actually release more mercury vapor into our oral cavity, which is then breathed in, and in gas form, it is the most absorbable by our body. Mercury fillings are the single greatest source of mercury exposure. I've actually heard studies that say that dentists, at least here in the United States, will contribute about 6 tons of mercury into the wastewater from the removal of mercury amalgam fillings, and in the case of some that are still placing. The first exposure to mercury from mercury fillings can occur at the moment of conception. This is true because mercury passes through the placenta to the fetus and through the breast milk to the nursing baby. Any effects we also know that mercury can cause on the mother, right, is passed on a couple generations, especially if the baby is a female. Because we do know that a female fetus, while in utero, already contains all of the eggs that she's going to have in her lifetime. So basically, as a mother, if you're carrying your daughter, you can say that you're carrying your daughter and your grandchildren. So any effects from mercury fillings on that baby are actually affecting that baby and the next generation, because it does have an effect over the ovums that baby is carrying. And again, that baby has all of the ovums that it is going to have for life in the placenta as a fetus. Chronic mercury poisoning can directly and indirectly contribute to an increase in the risk of every known disease and health issue. So again, I had mentioned that we were going to use numbers from several of the American administration agencies here. So we do have here the OSHA, which is the Occupational Safety Hazard Administration, and the EPA is the Environmental Protection Agency. So this graph here shows how much we are exceeding the maximum allowable levels of mercury. So, to be honest with you, when we practice dentistry here in the United States, if there's a release of 100 micrograms of mercury into the air, that is considered enough for us to have to evacuate the whole building, not the operatory, the whole building. And we can sit here and tell you that when we remove an amalgam, we are actually liberating between 700 to 1,000 micrometers of mercury into the air. So we are violating the standards set by our safety organizations, at least here in the United States, by, as you can see in here, drilling the mercury fillings by 80 times. We're actually exceeding the Environmental Protection Agency by 13,333 times. So the exposure levels when we remove amalgams, or when we mix an amalgam, or of having an amalgam, even having an amalgam, if you look at the first one there, it exceeds by just having 6 mercury fillings in your mouth, you're exceeding the level by 2 times, and the Environmental Protection Agency's number by 400 times. So it is incredibly toxic to the system, to the body, to the patients, to the whole team, and to the environment. Again, we go back to the OSHA limits, and I already kind of mentioned this. It's not to exceed 100 micrograms. And like I said, we really don't use mercury thermometers anymore, but back in the day in schools, if you had a mercury thermometer that would fall on the ground and it would break, here in the United States, they would evacuate that whole school, right? Because it would go over the limit of 100 micrograms. Now, when we open a capsule next, it's 400. right? When we're cleaning out the traps, when your assistants are cleaning out the traps, they need to understand that they need to wear all the protective equipment. They're cleaning the traps chair side. You still have 600 micrograms. You're over by 6 times. Drilling without water spray puts about 1200. Drilling with water, almost 500. Drilling with water and suction, now that starts to bring it down. If you start noticing, drilling with water and suction brings it down about 15 to 400 to 40 micros. So now we're going down under the OSHA limits, and drilling with water and suction is one of the basic premises of SMART. We'll talk about that a little later. And even polishing teeth when you're doing a dental cleaning or prophylaxis, either the hygienist, if you guys have hygienists, or the dentist, when you are polishing those amalgams, you are exceeding by almost 9 times the limits, again, established by the Americans Occupational Safety Hazards Administration. So I'm not sure how it is in Poland, but at least here, we're exceeding by 900 times. Facts from several government agencies. The WHO in 1991 said that dental amalgam is the greatest source of mercury burden in non-occupationally exposed population. So basically, if you have fillings, that's the biggest burden. Let's just think about what the burden would be for us dental professionals that are occupationally exposed to it. Right. So the daily exposure of amalgam, according to the WHO, is between 3 to 17 micrograms, with 10 being the average mercury vapor exposure per day from each amalgam. So Health Canada made a report in 1996 saying that the maximum tolerable daily intake of mercury would be reached with 4 average size mercury fillings. So 8 surfaces for a 150-pound adult, based on industry levels, and that's a really big deal. So these are the directions for use with Dispersalloy. So Dispersalloy was a brand of amalgam that was sold here in the United States. Pretty sure it was sold in Europe also. It was the #1 selling variant of amalgam used in the United States. And it would actually say that the use of amalgam is contraindicated in expectant mothers and children under 6. When you put 2 fillings together from a galvanism standpoint, so in proximal or occlusal contact with similar metal restorations, in patients with severe renal deficiency, in patients with known allergies to amalgam, it was contraindicated as a retrograde or endodontic filling, which was basically the premise of apicoectomies in endodontics. They would retrograde fill with what? Amalgam. So it's telling you it's contraindicated, but they would still use it. And as a metal filling for a cast crown. So this is the company that sells amalgam telling you what not to use it for, and we were constantly using it for those things. Luckily, a lot of the new regulations follow this and go a little bit farther. So the MSDS, or the Material Safety Data Sheet for mercury, right? For mercury amalgams, it actually mentions, and it's in there, it talks about chronic long-term exposure. Inhalation of mercury causes mercurialism. It says the findings are extremely variable and include tremors, salivation, stomatitis, loosening of the teeth, blue lines on your gums, which is the famous amalgam tattoo, pain and numbness in the extremities, basically makes patients think that they might have multiple sclerosis, nephritis or inflammation of the kidneys, diarrhea, anxiety, headache, weight loss, anorexia, mental depression, insomnia, irritability, instability, hallucinations, and evidence of mental deterioration. So Alzheimer's-like symptoms. I mean, this is a neurologic problem. It is attacking our neurologic system, and we are putting it, again, sorry about using non-metric terms, but we're putting it 2 inches from the patient's brain. And as you can see, it loves neural tissue. So, we find that it is very, very problematic. The United Nations established the Minamata Convention on Mercury. This was ratified on January 19th of 2013. And it's been adopted. It was adopted in October of 2013 in Komodo, Japan. And the major highlights of the Minamata Convention include banning the use of new mercury mines. They're trying to phase out the existing ones, phase out and phase down the use of mercury in a number of products and processes. And it's all about bringing down the use of mercury at the level, at the worldwide level. One of the addendums is based on dental mercury. And it was always one that got kind of kicked around and not 100% looked at. But lately, it's been looked at really well. The Minamata Convention entered in force on the 16th of August, 2017. And from then, it has had hundreds of countries have signed on to follow it. And this is something that now we're starting to see finally new change. We just had COP5, and at that convention, they were able to talk about setting up real concrete numbers. Like Europe, and I applaud you, Europe. Europe is going to institute a full-on ban on mercury, not only on the use, on the development, on the transport of mercury. January 1st of 2025, there is a full-on ban on dental mercury in the European Union. So bravo to you guys. We're still kind of working on that over in the US, but you guys are leading the way, and I'm very, very proud to say that. The African nations, they called for a full amalgam ban by 2030 at COP5. So as of 2030, the African nations are going to follow Europe, and that's the text right there. Again, like I said, the mercury recommendations in the EU, these are the ones that concern you guys. In 2018, they said that dental amalgam should not be used for dental treatment of deciduous teeth in children under 15, in pregnant or breastfeeding women, except when deemed extremely necessary by the dental practitioner. Now, the revised regulations, okay, as of this year, is that the mercury regulation targets the last intentional remaining use of mercury in a variety of products in the UA in line with commitments set by the EU zero pollution ambition, right? This includes a total phase out of the use of dental amalgam by January 1st of 2025 in light of viable mercury-free alternatives, thereby reducing human exposure and environmental burden. And again, it also prohibits the manufacture and export of dental amalgam from the EU as of January 1st of 2025. So we're less than a couple of months from that. And again, bravo to the EU. This is the strongest recommendations yet. There are other countries that have already banned amalgam use completely, as in Scandinavia has already done it. The Philippines have already banned it ahead of time, but the EU put out the largest recommendations since. As you can see here, an international amalgam phase down or bans are already in effect. Norwegian and Swedish legislation came into effect January 1st of 2008. Denmark came into play in April 2008, banning the use of amalgam. In Sweden, both health and environmental factors are status. So basically, again, like I said, Scandinavia was the first to do it. With the Bonn Declaration on Dental Amalgam, more than 50 non-governmental organizations and researchers are calling for the decision by the government, by the German government, to phase out amalgam by 2025 at the latest. And as we know, the EU did it, so it's happening. Italy has announced it will that it would phase out by December 30th of 2024, a day before the European ban. And the Philippines transitional period for the use of dental amalgam ended on 29th of May 2023. So the use of, and with them, it was the use of amalgam up to 14, pregnant, breastfeeding women. The import was already banned since 2020. So, they just instituted, finally the transition period is over. So the ban is fully in effect, even though the ban came into effect in 2020 in the Philippines. And now the United Kingdom is following EU guidelines at this time. They're following something there, which is great. So it's great to hear that, Europe, Scandinavia, and the Philippines are really, really leading the charge, and Africa's coming hard right behind for 2030. I'm hoping that the United States will decide to follow suit, and we should start doing something. This is the versions that were set in the United States. 2020, the US FDA published the amalgam recommendations that you see here. Again, it is pretty much following the EU recommendations of not using on children under 15, the nursing mothers. It's the same regulations as the EU, but we were basically doing a little bit farther behind. EU did it in 2018. We set it up in 2020 here through the United States Food and Drug Administration. In 2017, the United States Environmental Protection Agency passed a law requiring all dental offices to have an amalgam separator by July 2020, and it happened. I couldn't believe it. It happened. I didn't expect it to. Not in 2020, not with the administrations that we had and the government scenario that we had, but it happened, and if you don't have an amalgam separator in the United States, you cannot practice dentistry. So it is a very, very nice way of at least knowing that we're protecting the environment. And there are no phase out plans laid out by the US. So it's very sad for me as an American dentist to say this, but we continue the pressure, we continue the fight with the IAOMT, and I promise you that we will keep going. These right here are the fact sheets on dental amalgam that were established by the International Academy of Oral Medicine and Toxicology, the IAOMT. Basically, one is the human health risks, and the other is the dental amalgam impact on the environment. You can find these on IAOMT.org, and you can read through them aside with other position papers such as cavitations and fluoride and root canals and all the other stuff that has to do with biological dentistry. We have all of the position papers set on our website. So we're going to go really quickly here into the SMART protocol. So the IAOMT Safe Amalgam Removal Protocol recommendations were established, and they were updated in July 19 of 2019, but they were established on July 1st, 2016, when they were officially renamed as the SMART program. And a training course was given by the IAOMT for dentists to become certified in SMART. SMART certification signifies that a dentist has completed the IAOMT's educational program related to dental amalgam removal. The program is based on up-to-date science research and includes rigorous recommendations for removing existing dental mercury amalgam fillings to assist in reducing the potential negative health outcomes of mercury exposure to patients, dental professionals, dental students, the office team, and others. The IAOMT's recommendations are now known as the Safe Mercury Amalgam Removal Technique, or SMART. We're hoping that SMART will be seen as a standard of care when it comes to mercury removal in the future. And I did have a conversation with Katarina Griffiths, and she did mention that the Polish government was recommending the use of the SMART protocol for all dentists that are removing amalgam. So it makes us very proud to know that our regulations and our technique is being put out there, and it would be great to continue to have all dentists certified. It's a very simple process and program for certification. It's all online. The process has been, the program has been translated into many languages. I'm not sure if Polish is on there. I think it is. But if not, it is currently being translated into more and more languages as we go. And we're just looking for everybody to learn and to follow these techniques so that we can protect ourselves, our team, patients, and our planet. This right here is the checklist that we actually have on our page, thesmartchoice.com, and it allows patients to ask their dentists, especially if they're SMART certified, if they're following these protocols. So this protocol list, if you look at it, says December 6, 2016. It is was updated in 2019, and it is actually currently being updated again. It was just approved by the board. New updates are actually going to be released very, very soon. So, this is what patients should be looking for, and this is what we should be doing. And we'll go over it in a little bit more detail. So we did change the SMART certification to make it more true and have better integrity. The original program was based on an honor system, but we had a lot of members that were not actually, they were SMART certified, but they didn't have the equipment and they weren't following the processes. So now the requirements for SMART is to have active membership in the IAOMT. You can go to IAOMT.org. You can become a member of the Academy. We really, really want to strengthen our international presence. We want to have more dentists on our listing in different countries so that when we get calls at the office, or I get calls at my office, I have patients from Poland in my office that ask, well, who can my family who's still back in Poland see? I have one Polish patient who asks me that all the time. So I always tell them, the only one that I know of that's on the list is Dr. Griffiths. And but we would really like to increase this number, increase the net of like-minded individuals that are well trained, and I hope that a lot of you will contact the IAOMT. You can call the office, you can email the office, and speak to Sheila or speak to Betty, and they will look to getting you guys set up into the program. There's a scaled fee for membership according to each country. So here in the United States, we have one set fee, but for all international countries, there is a sliding scale. And when you call and find out, they will let you know how much it would be, how much it costs to become a member according to the country that you're in. With SMART, there's a $500 fee to enroll in the certification program. Again, there are some programs right now to help discount that a little bit, but you can talk to the office staff on that. But this is basically to have you enrolled in the SMART certification program. After that, you're going to complete Unit 1, Unit 2, and Unit 3 of our accreditation program. So the accreditation program is a 10-unit process to become an accredited member of the Academy, and SMART covers the first 3 units of that. That includes the introduction to the IAOMT, Mercury 101 and 102, and then it talks about the safe removal of amalgam, which is SMART. And you have to take the tests, and you have to pass the units. And once you pass those, and that's one step farther towards certification. Then we're going to require attendance to at least one IAOMT conference in person, and also taking the Fundamentals of Biological Dentistry course at that conference. Later on in this presentation, I'm going to have some information because we are actually going to have our first ever IAOMT World Congress of Biological Dentistry and Medicine in Istanbul, Turkey, because given that we've changed the requirements and we require attendance at one meeting in person, we need to have meetings in the European and Asian side of the world so that you guys can attend, not having to come over to Northern America to attend a meeting. Now, as of now, until these international meetings are set in stone, which ours is already, but we are accepting virtual attendance. So if the member cannot make it to the meeting, if it's an international member, they can actually attend virtually, because all of our meetings are broadcast live, and they can attend virtually. That does count for them as their meeting requirement. Also, another requirement is to do an oral case presentation. You have to present yourself working on a patient. You have to show your equipment. You have to show that you know how to use the equipment and that you're using it before we can certify you. We're not going to certify you on the knowledge alone. We have to know that you're using it. And then you're going to complete the final requirements of SMART, which consists about learning about the science that supports SMART, the equipment that's part of SMART, the resources at the IAOMT to enable the patients to implement SMART, right? You sign the SMART disclaimer, and then all SMART members, after they are certified, to be able to maintain their certification, aside from maintaining their membership in the Academy, they need to attend in person a meeting every 3 years. Okay, that maintains your SMART certified status on our public directory. Again, we are doing everything we can to make successful meetings in Europe and Asia. So we are hoping to actually be able to have it where it is easy for you guys to complete that in-person requirement. Again, we're working on it very, very hard. So we're going to go over the equipment needed for SMART. So we need an external air oxygen source. Okay. We need an at-source external aerosol vacuum. So there you can use, here in the States, we can get one called the Dentair Vac. The IQ Air is more available in Europe. So I know you guys can look into the IQ Air or any external, like it's an external vacuum. It's basically got a hose. It comes to the head, and that helps protect, right? The external oxygen source is going to be either a cannula or a nasal hood or a nitrous hood over the patient, giving the patient positive pressure oxygen. You need the high vacuum, the HVE, which is the high volume evacuation, which is basically your external suction. A non-latex nitrile dental dam. It's very important that it's nitrile because latex allows mercury to go through. And then you're going to want to go through a full body impermeable drape with a full face, neck, and hair covering. You want to make sure that the patient is completely covered, where there's no exposure. You're literally looking just at the patient's tooth that we're working. Behind the dental dam, we'll place a saliva ejector to trap anything that might make it through. Now, the gowns and non-latex nitrile gloves for the dentists and team members. Those team members will also be wearing a properly sealed respiratory mask with a mercury capture rated filter or a properly sealed positive pressure mask providing air oxygen for the dentist and team members. You can do that also. I use the 3M masks. I know that we've heard from some members that some of these are hard to find in Europe, but they are available and it's just a matter of finding. The other thing is you want to have a slurry of charcoal, chlorella, or a similar absorbent for before and or after the mercury removal to trap any particles that might make it through. And you want a well-installed and maintained amalgam separator. And then you want the informed consent form for SMART that we have available to all members that become SMART certified. There are some things that would be great if you have a window that you can vent the operatory. I mean, I can tell you my office wasn't built like that, so I don't have it. But the rest of these protections will kind of help. So I'm going to give you the detailed SMART procedures. So when we're talking about SMART, we're going to be really detailed. I'm going to read this because we're going to go over it. But an amalgam separator must be properly installed, utilized, and maintained to collect mercury amalgam waste, so it's not released into the effluent from the dental office. Each room where mercury fillings are removed must have adequate filtration in place, which requires a high volume air filtration system, such as an at-source vacuum, the one we're talking about, the IQ air, capable of removing mercury vapor and amalgam particles generated during the removal of one or more mercury fillings. If possible, like I mentioned earlier, the window should be open to reduce the mercury concentration in the air. The patient will be given a slurry of charcoal, chlorella, or similar absorbent to rinse and swallow before the procedure. I don't have my patients swallow it. That's one of the they talk about it in SMART. I have my patients rinse with it, and then we have them spit it into the suction because I don't find a use of actually swallowing the stuff in, not because the charcoal's a problem or the chlorella a problem, but if it's trapping mercury, why do we want to take it further in? No, let's spit it out. That's just me. These are the recommendations, but I will always talk about spitting it out. Okay. And protective gowns and covers for the dentist, dental personnel, and the patient must be in place. All present in the room must be protected because substantial quantities of particles generated during the procedure will elude collection by the suction devices. It's really not that much, but enough that we don't want it. It has been demonstrated that these particles can spread from the patient's mouth to the hands, arms, face, chest, and other parts of dental workers because we're basically sitting in that triangle above the patient's head where everything is basically coming onto us. That's why we want to be covered. That's why we want to be protected. You want to make sure that you're using non-latex nitrile gloves to be used by the dentist and all dental personnel in the room. Face shields, hair and head coverings are to be utilized by the dentist and all dental personnel. Either a properly sealed respiratory grade mask rated to capture mercury or a positive pressure properly sealed mask providing air or oxygen must be worn by the dentist and all dental personnel in the room. That is paramount. You have to have your mask. Even though you might feel like Darth Vader, I feel like Darth Vader when I'm wearing it. And it's hard to talk, it's hard to breathe. Luckily, we wear it while we're moving. Once everything's out, we can take it off and we keep our vacuum going to clean the air. An external air or oxygen is delivered by a nasal mask, a hood, a nitrous hood. For the patient, it needs to be utilized during the procedure to assure that the patient doesn't inhale any mercury vapor or the amalgam particulate during the procedure. You know, a nasal cannula can be used. I personally prefer to have something that covers the nose. There are some little nasal hoods that cover the nose that can actually just create like a bubble of oxygen around their nose that I just believe that it works better. Okay. The dental dam. Dental dam is the basic premise of SMART. If there's no dental dam, you're not doing SMART. It's as simple as that. You know, you have to use a non-latex nitrile dental dam placed properly and sealed in the patient's mouth. The saliva ejector is placed behind that dental dam to reduce any possible mercury that might get through. There's always going to be something that gets through. It's going to be trapped during that. Another thing that works really, really well is to have ozonated water. If you have ozonated water, the ozone will actually trap the particles because of its polarity and its charge. Will actually trap the mercury particles and drop them down onto the dental dam. I can tell you that I did SMART before I had ozone in the office and after I had ozone in the office, and the difference is marked. It's like heavy and it drops right onto the dental dam. On top of that, I also use a cream that I put on the dental dam called HGX cream, which is a mercury absorber, and that also works really well. We're going to keep going here. During amalgam filling removal, the dentist must utilize an at-source oral aerosol vacuum in close proximity to the operating field. So we go with that trumpet that comes under the patient's chin from the vacuum that is external. That vacuum will have 3 filters on it. There's a HEPA filter, There's a charcoal filter and there's a regular filter. So you are going to be trapping everything. Again, this is one of those things that when the assistants or yourself, if you're doing it, are changing the filters on the unit, you need to please be wearing the full protective equipment, because when you open up that filter, you're going to be exposed to the mercury that's been filtered through it. It says here, high-speed evacuation produces better capture when fitted with a cleanup device. The cleanup device is almost impossible to get right now. I think the company that had it closed. This was one of the original recommendations, SMART. I just use the high vacuum suction, and that does pretty well for me. You know, you want to use a lot of water, a lot of water. You want to have your water higher than you normally use it. You use copious amounts of water to reduce heat, and a conventional high-speed evacuation device to trap all that mercury in water to bring those ambient levels down, okay? The amalgam, we're not going to sit here and drill on the amalgam and paint it off. No, you want to remove it in chunks. So you basically want to cut around it and then cut through the middle, basically turn it into puzzle pieces that you're able to remove as large as possible using the smallest drill that you can. I use a 245 carbide. You can use a 330 if you want to go, but I find those to be a little too small. They break too easy. And what you want to do is literally you cut around and then you cut through the middle. Eventually, you know, there's no bonding to these amalgams. So unless they really, really use a lot of varnish, they should pop right on out, okay? Once the removal process is complete, you want to do the slurry again, and you want to flush the patient's mouth with ozonated water, okay? And in this case, for SMART, you have to remember this is set here in the United States. We need to comply with federal, state, and local regulations for the proper handling, cleaning, and the disposal of mercury-containing things. We really don't have a way to recycle mercury, so we have to throw it in the trash. What I do is that anything that is in a contaminated field, I hold it and I basically take my gloves, my nitrile gloves, and I enclose it within the gloves so that I know for a fact that it's as sealed as possible by the time it gets to the trash. The trash is taken out after every procedure because we don't want to leave it sitting there. All right. And then, like I said, during the opening and maintenance of suction traps or the IQ air, the external vacuum, you need to make sure that you're wearing the appropriate protective equipment described above. So these would be the two vacuums, okay? The smaller one is the Dentera-Vac. That's the one that I have. The bigger, prettier unit over here is the IQ Air. That is the one that's relatively available in Europe. It is a great unit because not only does it filter with the I call it the elephant trunk. With the elephant trunk there, the unit next to it actually works as a whole room filter. So it is a great unit to have. I have the other ones that are a little bit smaller, but you know, I'm considering getting an IQ Air. So these are pictures of my team and myself in our full dress getup. As you can see, we are fully covered up, wearing you know, mercury rated masks. Again, that would be me there with the full face mask. I look and sound like Darth Vader when I'm wearing it. We protect ourselves. You look in the bottom picture right there. Our patient is fully covered. The only thing that you can see of the patient is actually the tooth. And then we've got our SMART certification poster there. And we hand out these little pins once patients are done saying that they don't have any mercury anymore. More pictures of the procedure and how you go about doing this removal, right? You cover up the patient. Every single layer is covered. Like you can see, there's a face drape around the face of the patient. Then the dental dam goes on so that the patient is not exposed at any point. And then you see the vacuum hood there that sits at the chin of the patient to trap everything. And if you look at the dental dam, you see that little white paste on there. That is the HGX cream. And then there's a picture there of the full removal. Once the amalgam is out completely, removed in chunks, we'll clean off any of the staining. I'm not very incredibly aggressive with taking off all the stain material because, you know, I don't want to completely destroy the patient's tooth. But as long as the metal's gone, I am a very happy camper. Again, this is over here on the left, well, my left, it would be your right, are the pictures of the oxygen tank for the positive pressure, and that's the external vacuum. You've got the HGX cream there, and you have the charcoal slurry that I use with every patient. And you can see my assistant, Trisha, there is wearing the nasal hood that we place on every patient. And the picture over here on my right, on your left, is the view from above of how the patient looks, and you can tell the patient is fully covered, no exposure, and I'm covering everything there. Over here, you can see pictures of two different types of amalgam separators. The only reason why is if you look at the little one that looks like R2D2, it looks like a droid, it says Liberty Boss down there. That's the one I'm using right now. I do prefer that one, but originally I had a Solmetics, which is the one that's mounted on the wall. And it's funny because that picture was taken by my technician when he installed the Liberty Boss and then removed the Solmetics. So you can actually see both of the separators were in place. I had the Solmetics originally installed, and then we changed over to Liberty Boss because I find it to be a better product. The Liberty Boss, you just have it replaced every year and a half, 2 years. You don't have to mess with it. You don't have to touch it. The Solmetics, which is the one on the wall, you actually had to pay attention to the canisters, take the canisters out. One time I was doing it, my assistant thought she was helping me and she turned off the vacuum. You have to do it with the vacuum on, and I had the mercury sludge all over my hands. Luckily, I was wearing full protective garb, but I prefer the Liberty Boss. I don't know if you guys have it available in Poland, but and then again, you can see another picture of my oxygen and my external vacuum right there. That's a really, really old one. That's why it's a little bit bigger. Right here, you have the websites for the IAOMT.org and then the website, which is the smartchoice.com. Both of these pages, you go to the IAOMT.org to become a member, but you'll also have a listing on the IAOMT page for all of the members. We have every member in every country who's a member shows up on that listing, so that when patients are looking for a dentist that follows the right protocols and they're looking for that nice, strong biological dentist that does safe mercury amalgam removal technique, it'll be listed on there and we can recommend for them to go. The Smart Choice is more of a commercial page that was put out there for the public, and they can find out about the process, about the procedures. It basically links into the IAOMT page for the listing. So you have two pages out there where you show up listed. The benefits of being SMART certified, membership's benefits of the IAOMT is SMART certification. There's a vast IAOMT biological dentistry library. There's accreditation opportunities. You can become an accredited member, a fellow, or a master. Again, I try to remind everybody that SMART is the first third of accreditation. So once you become SMART certified, you only have 2/3 of the way to go. And it's highly recommended that if you are doing SMART certification, continue to finish the next 7 modules and you can become accredited. Before, it used to be that accreditation was $1,000, but for members that become SMART certified, since they've already paid $500 towards the SMART certification, then to become accredited, they just have to pay the other $500, and you get both certifications basically for the cost of what the accreditation would have been. So it is a great opportunity to stand out, to show that you really believe in biological dentistry, and to show that you've done the studies, that you've done the training, that you know what you're talking about. And then as you're a member longer and you do scientific reviews and other involvement, you can become a fellow or a master of the academy. I'm a fellow of the academy. Like here in the state of Florida, I'm the only fellow. So it gives me a little bit more, I guess we could call standing, but it just basically makes you more visible. And patients, at least here in the States, they like to see fellowships, they like to see masterships. It just makes you look like you've got a little bit more skin in the game, and you've taken more time to learn and do all that. We've got 2 annual meetings a year here in North America, and we are planning our international meetings. Our goal is for that international meeting to be a yearly thing. We're starting with May of 2025 in Istanbul, and from then on, our plan is to keep this going. I mean, it is the International Academy of Oral Medicine Toxicology. We need to make sure that we highlight the I in IAOMT and keep it international, and have an outreach to your international members and bring you guys into the fold, because it's not the American Academy of Oral Medicine Toxicology, it's the International Academy of Oral Medicine Toxicology. I'm from Puerto Rico. It's really important for me to bring everybody from outside the US to join this amazing academy that has given me so much, but it also helps us so much. Like I said, the international meeting is not planned, it's happening. It said planned, it is happening. It's already set. We've got the contract signed and everything. We're getting our speakers, and we're going to have some amazing speakers. All of them are going to be European or Asian speakers. There are going to be some IAOMT members doing the fundamentals of biological dentistry class, but our main podium speakers should be a great menagerie of amazing international, European, Asian, uh, you name it, Pan-Asian uh, speakers talking about all kinds of different aspects of biological dentistry and medicine. It's going to be a great meeting. I promise you that. You have access to meeting recordings for international members at no additional cost. There's a vast network of members and fellow biological dentists. Research and science. We have a whole research and science library, and there's opportunities to participate in the academy. You can become an ambassador in your country for the IOMT. You can join the board. You can get to the point of being named to the executive council and serve farther on the academy. This is what I've been talking about. You can scan that code and it'll take you to the registration page, which I'm hoping will be active very, very soon. This is the IOMT's first World Congress of Biological Dentistry and Medicine. It's going to be held in Istanbul, Turkey, May 15th to 17th of 2025 at the Swiss Hotel, the Bosphorus. It is a beautiful hotel in an amazing city. We are really excited to bring the IOMT to Istanbul, where the East meets the West. This is going to help bridge countries, bridge dentists, bridge the international community, and bridge the IOMT so that we can all grow in the same direction and all have the same. So again, you can scan that QR code there and it will give you the information to sign up. And I hope to see a lot of you there. I will be there. I will be speaking during the fundamentals of biological dentistry course, but also, this is our baby. Myself and a couple other members, we have been working hard to get this meeting going. So I hope to see you guys there. I'm going to end with a couple quotes that inspire me. One is "To be the change you wish to see in the world" by Gandhi. That's a photo in Puerto Rico. I just thought it was amazing with the windmill and the light and everything. And then, when it comes to everything that we do in biological dentistry, try not, do, or do not. There is no try. Those are beautiful words by Yoda. And, we can get to if we start talking about energy medicine, we can also talk about another quote by Yoda, which is "Luminous beams are we, not this crude matter," because it's all about energy medicine. But that's not my topic today. So we'll leave it there. And I want to thank you so much. I hope you guys enjoyed this lecture and this topic, and I hope to see our network growing in the IOMT. I'd hope to go in there and pull up Poland and see a bunch of names pop up. I implore you guys to join us, and I'm not saying this to get members or anything like that. I want a network. I love to take my CE in Europe. I love to network with European colleagues and Asian colleagues, and it allows us to learn from each other. The best education I have ever gotten in biological dentistry has been in my studies when I go to Europe, when I go outside of the United States. I learn a lot here, don't get me wrong, and you guys can learn a lot over here. So if you can make it to one of our meetings in the States, I recommend you guys come on down. But we can learn so much from each other, just like the message with Istanbul. Let's bridge the gap between East and West. Let's all get together. We can do so much for our patients. We can do so much for our profession. We can make everything better. And I want to thank you so much for your time, for your attention on this subject. And I hope you're the best. And thank you so much for attending. And thank you so much for doing what you're doing for our patients and our planet. Take care.